Hey ladies, today we'll be delving into a fantastic topic, ovulation. We'll explore what it is, when it happens, and why it's so important. So now, what exactly is ovulation? Ovulation is a phase in your menstrual cycle when a mature egg is released from the ovary. This egg then travels down your fallopian tube, waiting to be fertilized by sperm. Let's talk about the menstrual cycle for a minute. It starts on the first day of your period, known as the follicular phase. During this phase, your brain releases the hormone called FSH, which helps an egg in your ovary mature. Once this egg matures, there is a surge in another hormone called LH, which triggers the release of this matured egg from the ovary. Now, when does this occur? Ovulation typically occurs between 14 to 16 days before your next period. For example, for a 28-day cycle, that's around day 14. But remember, ovulation day can vary as your cycle length may be longer or shorter. Now, how long does ovulation last? An egg only survives for 12 to 24 hours after ovulation. If sperm doesn't fertilize this egg, your body reabsorbs it. Unlike your egg, sperm can survive for several days in your body. Let's discuss the fertile window. This is the number of days leading up to and including ovulation itself. It usually starts about 5 to 6 days prior. And you should know that having sex during this time increases the chance of pregnancy because, as we said earlier on, sperm can last up to 5 days in your fallopian tube. And this sperm is usually ready to fertilize the egg once it's released. After ovulation, the egg travels through the fallopian tube waiting to be fertilized by a sperm. If this occurs, it continues to the uterus and implants in the uterine wall, starting the journey of pregnancy. So now let's talk about the symptoms to look out for. Not everyone will experience ovulation symptoms, but some might notice swollen or tender breasts, increased vaginal discharge that ranges from white to clear sticky discharge, headaches or nausea, mild abdominal pain, increased sex drive, or even mild spotting. How do you know when you're ovulating? Here are some few methods for you to track your ovulation cycle. 1. Using your menstrual cycle. In a 28-day menstrual cycle, ovulation usually occurs on the 14th day. However, you should know that a normal cycle length can vary from 21 to 35 days, and it's advisable to track your cycle length over a period of time in order to identify when you will be ovulating, which is usually about 14 days before your next period. 2. Another method is observing your vaginal discharge. Your vaginal discharge changes with each phase of your menstrual cycle, from clear to white to you having no discharge at all. Also, body baseline temperature is another way. During the time of ovulation, your body temperature increases slightly for a few days, and you can detect this by checking with the thermometer before getting out of bed in the early morning. 3. Ovulation predictor kits can come in handy as well. It works by detecting luteinizing hormone in your urine, as there's usually a rise in this hormone right before ovulation. Now, what can cause you not to ovulate? There are certain conditions that affect ovulation, and they include polycystic ovarian syndrome, popularly known as PCOS, if you're breastfeeding or have high levels of prolactin, if you are experiencing something called primary ovarian insufficiency, you're menopausal or perimenopausal. If you're not ovulating and you're trying to get pregnant, it's important to talk to a healthcare provider, as they can help you understand your symptoms and can then decide on the best treatment based on your condition. That's it for today. I hope this helps you understand ovulation better. Any questions you have, please leave them in the comments below. See you next time.